In marking Tuberculosis Day, with this year's theme being Invest and NTB Save Lives. This comes amidst calls for the government to invest in the fight against the disease, which heavily relies on donor support. According to WHO, 4,100 people succumb to TB every year globally. Here's Violeta Uma with the story.
Lilian Musikevu lives in Marava slums of Lurambe sub-county in Kakamega County. The mother of two was diagnosed with tuberculosis, commonly known as TB, in 2018.
Nilikuwa naona tu kila saa mimi mgonjwa, kila saa nguvu inaisha, siwezi tembea, safari mrefu, siwezi beba kitu, kifua kila saa inajaa. Nikaamua kwenda hospitali.
Just like many here, she perceived TB as a death sentence, associating it to HIV and AIDS. At some point, she stopped taking the TB medications.
Kaniambia zini TB, nianze dawa. Kaanza dawa, kumeza, si kumaliza. Kafika mahali nikachoka. Kidogo tu nikachoka, nikaacha.
Her health deteriorated. She had to start medication afresh, but at this point, she had developed the multi-drug resistant TB.
Yes, mara ya kwanza nililia, nikasema kwani ni nini, sasa mimi kuisha.
Lilian is among 14 other patients who are battling multi-drug resistant TB in Kakamega County.
Nilifika mahali nikaachia Mungu maisha yangu. Sasa hiyo kuisha yenye nilikuwa naisha, siwezi tembea. Nikafika mahali sasa nasikia hata ukisikia zini kukohoa, unakohoa kwa kifua. Na nilikuwa naumia. Hata nikikaa tu hivi sana, nasikia kitu iko hapo. Ukifanya hivi hiyo kitu ni kama yani kuna kumawe tu hapa kwa kifua.
According to the World Health Organization, 4,100 people lose their lives every day to TB, and close to 28,000 fall ill with TB, which is preventable, treatable, and curable. Kakamega County TB Coordinator Emily Vuguza says everyone is at risk of contracting TB, urging residents to visit any of the 276 health facilities that provide TB testing services in the county to know their status.
Demystifying the fact that our people also still go to over-the-counter for medication. We want them to ensure that they go to a health facility, not going to a chemist.
Vuguza says lack of finance, shortage of healthcare workers, and COVID-19 pandemic has crippled efforts to combat TB.
The signs and symptoms, both for TB and COVID, are the same. So people are shying away to come to the facility to take a test because they were fearing they'll be quarantined because of COVID. And again, some challenge that we face with the gene expert machines is the commodities. Yeah, cartridges has been a challenge. Like for quite a number of months, we were able to go without them.
According to a report by the Ministry of Health, 140,000 people were diagnosed with TB in the year 2020, with 33,000 deaths reported annually. Vuguza says stigma and misconceptions have been a barrier in achieving countries' commitment to end the disease by 2035.
Stigma associated with TB is something that again makes our patients to interrupt treatment because after diagnosis we find even their own family members, they abandon them. Yeah, because now a diagnosis has been made, they want to discriminate them. In 2019, we were able to notify 2,384 cases, and 2020 we were able to notify 1,987. Come 2021, we were able to notify 1,900 cases. And among these, the males are more affected than the females. And again, we find that the age group that is most affected is ages between 25 and 55 years.
TB is caused by a Mycobacterium tuberculosis that affects the lungs and other body organs. It spreads when a person with active TB disease in their lungs coughs or sneezes and someone else inhales the expelled droplets. The symptoms of the disease include coughing for 3 or more weeks, chest pains, unintentional weight loss, night sweats, chills, fatigue, sweating, loss of appetite, among other symptoms. According to World Health Organization report, TB remains one of the 10 leading causes of death. The report estimates that a quarter of the world's population, translating to 1.7 billion people, are latently infected with TB. In 2018, WHO reported 10 million people were diagnosed with TB, while 1.5 million of them died.
Information is a contributing factor because quite a number, we've not invested much in advocacy and communication and social mobilization for our community. And that is how, again, we want to ensure that we are opening up even to meet the people at the community levels, to educate them. Even as they come to the health facilities, we want them to be given the health education.
The national government launched a program that enables multi-drug TB patients receive a 6,000 shillings monthly stipend to ensure they do not interact with members of the public to prevent transmission.
The MDR patients, they are on NHIF, that they are covered so that during the period they are on treatment, the patient plus the household are given a cover of NHIF, and again they are given 6,000 for stipend to ensure that they can also be able to buy food, and because we don't want them to mingle or to go out to look for employment.
The TB coordinator says more needs to be done to avert TB burden in the country. As we celebrate Tuberculosis Day today, Lilian is overjoyed at her 18th and final month in her medical journey.
Zilikuwa mingi, usipokuwa na roho, uwezi kabisa. Ini inafaa unajiamini juu, unajali maisha yako, maybe uko na watoto, utaachia nani watoto wako. Ungeniona.
Violet Auma, TV 47, Kakamega.